I would come into my patient's room. I would close the curtain for privacy, perform hand hygiene. Good morning, I'm Tiffany. I'm your nurse today. May I please verify your first and last name and date of birth and I would compare it with their wristband. Thank you. Okay, so the doctor has ordered the insertion of a Foley catheter, so we're going to go ahead and get started with that. Before we do, I'd just like to verify that you don't have any allergies to latex. I didn't see it in your record, but I would like to just double confirm. Okay, great. So no allergies to latex. So what I would do is I would raise the bed so it's at a good working position for me. I would put the patient's head back. I would ask them to bring their knees up, put their feet together, and butterfly their knees so that I have access to insert the catheter. Perfect. So what I'm going to do first is I'm going to go ahead and get you cleaned up a little bit. So I put on my clean gloves. I will grab my washcloth. Okay. So first we're going to go ahead and I'm going to open the labia and I'm going to use my non-rinse cleanser. And I'm going to clean the area furthest from me. I'm going to rotate clockwise. I'm going to clean the area closest to me. Rotate clockwise again on my washcloth. And then I'm going to clean straight down the middle here. Okay, and it's going to go into the wash bin. Alright, I'm going to go ahead and remove my clean gloves. I'm going to perform hand hygiene. I'm going to get my catheter kit here. I'm going to open it up. Sure you can see it here. Normally I wouldn't be moving it around, but I'm trying to make sure that you'll be able to see what I'm doing. Okay, so we're going to go ahead and use this bag of the garbage and I would place it right here. And then I'm going to open my kit by only touching the outside borders. I'll open furthest from me. Open the sides, maintaining my 1-inch border. Open the bottom. Okay, and then you just kind of work down in your kit. So we're going to go ahead and grab our gloves, which are latex free, by the way. We're going to maintain our 1-inch border. I would use my non-dominant hand to pinch here and my thumb. Okay, and then I would insert my hand in there. Okay, and then with my sterile hand, I'll go ahead and open the cuff. And I would put on my second glove, maintaining sterility. Make sure I only touch the sterile part of this and put it in the trash. And then I would get, my hands are sterile now, so I can work in my kit openly. So I would go ahead and put shiny side down, ask my patient to lift their hips. And I would put that there. I would drape my patient here. Only touching the drape. And then I want to get my kit ready, so that way when I insert the catheter, everything's ready to go to make it easy peasy. So I would open my swabs, pull them out, that would go in the trash. Set this here for my workstation. I would have that there. I would open my lubricant and I would place it in the tray. And then the rest would go in the garbage. I would open my catheter here. I want to do it slowly because I don't want the catheter to just flop out and then touch a non-sterile field. So we're going to go ahead and do that. And then I would place it in the lubricant. Kind of, roll it around in there a little bit. Make sure it's good. And then I want to get my syringe. We'll take that cap off. And then I want to make sure that it's ready to go nice and tight in there. I give it a little twist. And then I can put that. Oh, no, it didn't want to stay in there. Let's try that again. Normally it would stay in, but because I've done this before, it wants to pop out. So, and I'll pop that out again. Okay. Typically, this would not happen, but because it's not the first try, there's like, it's creating a pressure. It doesn't like me. Okay, well, it doesn't want to stay in, so it's probably going to pop out again, but typically that would not happen. Okay, so I'm going to go ahead and place that here. So it's going to pop out. I'll put it back in. Okay, so now what I want to do is I would go ahead and I would use my non-dominant hand to open the labia. I would grab a cleansing swab and cleanse the area from top to bottom furthest from me and discard. Area closest from me, top to bottom, and discard. And from top to bottom, straight down the middle, and discard. And now I can't remove my hand until the catheter is inserted. So, this is going to be fun with the syringe. Let's see here. So I have my catheter. I grab it about 2 to 3 inches. And I'm going to ask the patient to take a deep breath. All right, and as they exhale, I'm going to insert the catheter. A little bit more challenging this time because the balloon has already been inflated while I was practicing. So it's causing a little bit more resistance. Then make sure that I'm only touching the catheter tubing. And once I get urine flow, I'm going to insert it another 1 to 2 inches. And then I'm going to grab the catheter so it doesn't pull out with my non-dominant hand. I'm going to have my syringe here. Keeps popping out. There. I'm going to place it just against here to hold for traction. Normally I wouldn't do that, but it keeps wanting to pop out. So then I'm going to... That would also not happen. The syringe will not stay in the tubing, which is not typical. So it's not staying in. But what I would do is I would insert, my syringe would be in the tubing. I would insert the full 10 mils of the fluid to fill the Foley balloon. And then I would discard of this. I would go ahead and touch the catheter and give it a little pull to make sure there's traction, which there would be because the balloon would be filled. And then I would go ahead and make sure that I had my tape or my little clamp available. And I would clamp this to my patient's leg so that it was in place, but it's not pulling on them, causing any discomfort or friction to their urethral meatus. And then I would go ahead and make sure that my tubing here is not, that it's straight, there's no kinks. And I would attach this to the bed frame. And then I would go ahead and get my patient cleaned up here. I will grab all of my equipment here. And discard of this. I would discard of my gloves by pinching and pulling off. And then with the clean inside part, I can loop it around there to finish pulling off. I would perform hand hygiene. I would put my patient in a comfortable position, cover them up, make sure they have their call light, and let them know you are able to move around with your catheter because it is attached to your leg. You just don't want to get the tubing twisted or anything like that. If you need help, please push that call light and I would be happy to help you. Okay, and then I'm going to go document.